The sprawling west side area of Chicago is just a few miles away from the city's downtown. But the average life expectancy here is just 69 years of age. That's 9 years below the national average and 16 years behind those living in the more affluent downtown area. This 16-year death gap was uncovered by the Rush University Medical Center.
Not just because people on the west side didn't eat their broccoli last week. There is something about the social conditions. We know that what drives poor health is economic conditions and wealth, it's educational outcomes, it's safety in the neighborhood, food access, and it's not just health and healthcare.
Following the findings, Rush helped initiate Westside United, a collective of local hospitals, non-profits and government agencies. The organisation is committed to cutting the death gap in half by 2030.
It's a multi-pronged, multi-sectored approach that's working to disband conditions that have been put in place over the last 50 years. You can't just throw millions of dollars without sustainable capacity building strategies.
One key element is the promotion of healthy eating habits. But vast areas here are classified as food deserts. Angela Taylor is the wellness coordinator for the Garfield Park Community Council. She helps operate a community garden that aims to address that.
From right here where we're standing, you could not go in a 1 mile direction, east, south, west, north, and find a grocery store, because there is none.
Chicago's West Side area also has a large unemployment rate due to a lack of jobs, disinvestment, poor schools and a high incarceration rate. Beelove is a company that makes natural honey and honey-infused skincare products. It also employs returning offenders and has just received a grant from Westside United.
Although Westside United can point to some significant achievements, it's also clear that more work here needs to be done. But organisers are confident of further progress in the future.
This is a long-term commitment, so I know that the institutions that are at the table are in it for the long haul. I hope that we can keep engagement with the community at the forefront, as bringing more stakeholders and continuing on our mission to decrease the life expectancy gap by 2030.
There are many areas across the US facing similar demographic divisions as Chicago. This model could help provide them some much needed answers. Dan Williams, CGTN, Chicago.